Hello, friends. Good evening to all. As you all know that in last week I have posted the questions on the respiration for your help and for your guidance about how the respiration topic is look like because when you are uh, studying continuously with the subjects because I have contacted many students and whenever I ask to them how you are preparing and what are you studying, so they are telling me about the specific subjects every time. So you can study as you wish, as you feel comfortable. But as you all aware that NMC has changed the system and they have adopted the integrated approach, and on that approach, the questions paper for the post graduations NEET PG is also coming up. They asked the questions in last two NEET PG questions are were integrated one questions, and the next NEET PG, which will be a last NEET PG on 23rd of January 2023. Uh, so in that also you will find the integrated questions. So what I did is I post about your respiration topic, how it look like, and what to do, how to study, because it's very important that if you think about the respiration, then it starts right from the anatomy, the lungs anatomy, the lung hilum diagram is very important one, and the histology of the lung. So basically, you should know about the what is the histology, so that if any deviations come, then you can identify the slide and you can give the answer on that topic. Another one is the if you go for the physiology, then different kind of physiological respiration physiology is there. What is the effect of temperature, pH, pressure on the rate of respirations? What are the physiological processes takes place during the respiration in the lung at the cellular level? What happens in the this anaerobic respiration or aerobic respiration? So all kind of stuff you read in the physiology. Then comes biochemistry, what enzymes required for the gaseous exchange or for the respiratory process, because you all know that respiratory process is associated with the production of ATP also, because oxygen is required in that process, ATP formation. So biochemistry roles also comes over there. Then you comes to the second MBBS, comes to the microbiology, then because you are inhaling air, and there are many infective agents in the air like bacteria, virus, or fungi, or some occupational exposures are there. So all you are inhaling. So what are the infective agents uh, which can cause the respiratory disease? You study in the microbiology like pneumonia, or which is very common. But pneumonia, the agent may be different. So what kind of agents and how to present? So it's very important in microbiology. Coronavirus, viral disease, viral pneumonia, then fungal infections, and also respiration may be the source of the infection to the other parts of the body. So you must understand about that in microbiology. Then you come pathology, the pathological conditions. Then it comes down to pharmacology, the drugs acting on the uh, drugs acting on the lungs. So then you go for the managements in the surgery and medicine. Respiratory medicine, tuberculosis is a special branch in the uh, post graduation. So this is very important. So that's why you are getting questions on this, and very frequent questions. So what I did is I make a reference presentation for you. It's a very extensive presentation, but it is not complete one. But yes, it will give you a broad outline. It will help you to understand the topic, and it will uh, give you the hunger. It will push you to read more, or the topics where you cannot understand from those one or two slides, because that's very limited. If you want to go for the respiration, I can make it more than 1,000 slides. So I have to be selective, and that's why I selected and I did my best to prepare that uh, s- slide. And I post a link on down below on description box, so that you can download from there, and that will be used by you later on whenever you need it, and you can make the notes on it if you like to make. So all things, what are the component of respiratory system, anatomical things is concised in one slide, very important, so that you can go through it. The modes of breathing, then different respiratory volumes. I also concise this on the one slide, in a way that it will be easy to remember that what volume is what. So that is there. Then forced vital capacity, pulmonary function test, the how the lung look like, where the gases exchange takes place, how the gases exchange takes place, what are the effect of the pH, temperature, or pressure change on the respiration, on the hemoglobin saturation. So carbon dioxide transportation is very important. So where it takes place, and how the respiratory regulation is through the different method in chemoreceptors, baroreceptors, starch receptors, chemical stimuli, other stimuli. So all things, central, peripheral receptors. So all things has been concised and mentioned in that presentation. So you can go through it. Different scenario of the carbon dioxide transportation is given in that presentation. So you can go through that. Then chemoreceptor reflexes. So then regulations, then microbiology part is included in that one. So infections were there, diagrams, very important diagrams are there, microbiological diagram, which you won't find in you will difficult to find in the your regular textbooks. But I try to capture those diagrams, so because sometime you may find the diagram questions on that one. So you can go through those diagrams and see that what are there, pharyngitis, tonsillitis. So how it look like in under microscope, or grossly how it look like. So for example, tuberculosis is very important. So grossly testing on the lab in a test tube, a microbiologist can tell this sample is positive for the tuberculosis or not, without going under the microscope. So this is very important thing one. So different kind of pneumonia. Then it's a very important, you will find a one question definitely in your next exam about the curve 65 score. What is that score, how it is utilized, what is the importance. So that is mentioned in that, and you will find definitely a question on this one in your next exam. Then pulmonary infection score. So that's also required, and sometime, and this is mainly pulmonary function score is important for the INI-CET exam. So they may ask in the INI-CET examination. uh, then what is the lobar pneumonia picture, X-ray diagram, intestinal pneumonia diagram. So bronchitis and bronchiolitis, lab diagnosis for upper respiratory tract, for the lower respiratory tract. Why these are important is because these are the basic things. As I mentioned in my previous video also, that whenever a question comes, you must think of a basic. For example, a question asked in this recently concluded NEET PG examination was, they have given the scenario of post COVID black fungus case. So what next? They ask what next. So people, I've gone through the responses, and I noticed that uh, more than 97, 98% have gone very advanced. They say we will go for the CT MRI. Why? Okay, they have given the scenario, the symptoms, which looks like a black fungus case. It may be some other reason. So, first thing, in any case of infection, be it respiration or any other system, if it is an infective case, then you have to establish the cause, and for the establishment of the cause, you need the basic investigation, culture sensitivity. To for the culture sensitivity, you must know how to obtain sample. So the answer of that question was to take a nasal swab and send for the examination, so that the microbiologist will tell, okay, this is a case of black fungus. We know this is a case of black fungus, but we need an evidence to back up our knowledge. So that's why it's very important to know about the basics of diagnostics. So I have very precisely mentioned about the upper respiratory tract and lower respiratory tract investigations. Then microscopic, different kind of stains which we use. What are the criteria which we used for the neutrophil, for the microscopy, or for the squamous epithelial count? So when we will declare it is normal, when will it declare it's abnormal? So that's, and the scoring based upon that. So this microscopic scoring is very important for the INI-CET examination. Then culture media required for the different bacteria, different medias are required. So I have tried to capture the important bacteria and their medium for growth, their picture. So this is very important. That's fried egg appearance, seen in which they may ask, okay, this is picture, this finding, and on microscopy there is a fried egg appearance. What is the causative agent? So you must know the fried egg appearance in the mycoplasma. So that kind of scenario is mentioned over there. Then treatments um, of pneumonia, um, then hospital acquired infections, the uh, non-infective disorders, COPDs, what are the features, emphysema, chronic bronchitis, lung cancer, sudden infant death syndrome, asthma. So asthma is, you know, asthma is described in one slide very precisely. And then I mentioned about the development of the respiratory system, the embryology part also included in that one. What are the effect of the aging on the respiration? So what is decreased, what is increased? So all kind of mention is there. Respiratory rate effect, age per age is also mentioned. And what causes the respiratory conditions in then drugs acting, different drug acting on the respiratory system. And they're very important things were mentioned in the slides were warnings. These are very important slides, you must know about that one. And most of the time student making mistakes when they are attempting those questions. So warning were mentioned on that one. So glucocorticoids, then tuberculosis differently, because it's a very important topic. Uh, then it's very important about the, if you have noticed that I have asked about the uh, occupational exposures question in the questionnaire also. So this is very important. And uh, this is mentioned in the there. Then ILO radiological classification is there for the occupational exposure, International Labour Organization classification. Mind it, they may ask a question very simple. It's a very simple question, that for the occupational exposure, respiratory disease, which classification is used. They may give you WHO classification, they may give you the Respiratory World Congress classification, they may give you the OSID classification and ILO classification. The correct answer is ILO classification, International Labour Organization radiological classification is used for the management of occupational uh, exposure disease of the lung. So this is very important, and you must remember this one: asbestosis, silicosis, what kind of picture seen in the CT scan, or what kind of picture you will see in the X-ray. So you will find everything over there. What is the gross appearance? Maybe they can this, because this is related to forensic medicine. So if patient comes dead patient, they will not give history, but they will give other pathological or biochemical findings, and they will say on grossly, as per figure shown, this is the picture, what the cause. So gross appearance, what is the gross appearance of the plaque? Then Kohlberger pneumoconiosis is very important. Mm, then sick building syndrome, then tumor, mesothelioma, small cell carcinoma of the lung. So all kind of I have tried my best to cover the every topic in the that presentation, and now comes to the briefly. I'll share the answers with you in detail. You can go through with those answers uh, when you download these things. So I think it is visible to all of you. So this was the questions which we asked, which we will discuss right now. That there were 40 odd questions were there, and given figure show pulmonary function test tracing. So the answer is given below, but if you go through these answers and you go through the presentation, then definitely you will know that, and how to identify the answer. So the answer is given in front of you. Why? Because there is a one ratio is given. So definitely, if in that ratio, if the value below value like FVC is decreased, then definitely this ratio will increase. FVC ratio will increase, and as we all know that in restrictive lung diseases, the FVC is decreased. So that's why the answer is A. So answer is in front of you. So you have to be judgmental about the when you are looking at the questions also. You can get the answers very well. Then evaluating the comma cause. So I have mentioned this one, and then illustrate uptake of two gases. The gaseous, this question related to anesthesia uh, is comes that dissolving the different value. We must know about this is very important. And then again physiological response, that what happens to the from C to the higher level. And so these questions, if you go through these questions, a 55-year-old male, history of smoking, present with a chronic cough with expectoration, exhibit dyspnea on exertion, stocky building, show some cyanosis. So cyanosis means lack of oxygen. So which receptor is involved in this one? So you must know that what are the receptors are and how they are getting stimulates or depressed. So explanation is given with the question answer. Uh, then it's a very important question. Is the question number 8. If in I asked that in February, patients coming from the community develop the abrupt onset of febrile upper respiratory tract illness. They have received no immunization in last year. Culture of the nasopharynx of the patient show influenza A virus. So they will give a diagnosis. But what happened is you note down the word first line in a nursing home. Nursing home is a closed setting. While if I ask about the community, then it's a broader setting. So answer will be different. So nursing home means we will go for the drugs. And if it is we ask for the community, then we will go for the preventive aspect. So in this case, the answer is amantadine. But if I ask about the community, then answer will be the influenza A vaccine. And this is just to confuse you about the influenza virus, that influenza A, B, C, D, because as you all know that influenza virus has two type of protein, and this is showing the uh, very rapid changes, antigenic structures of the influenza virus changes very rapidly, which we termed as genetic drift and shift. So it's a classical example of the virus which show genetic drift and shift are respiratory viruses, particularly influenza virus and coronavirus. So then question number 10 about the tuberculosis. Question number now it's a very important. The explanation is not given in the question 13 directly. You are seeing the yellow mark over here. If you click to the yellow mark, then definitely you will find the explanation here. So this is a very long question and it is just to confuse you. In this, the keyword is gynecomastia. Atypical finding which you are seeing is, which keywords are smoker, and secondly gynecomastia, the enlargement of the breast. It's a male enlargement of the breast. So you must remember that in a large cell carcinoma of the lung, majority of the patients beta HCG level increased because the cell line of the large cell carcinoma of the lung in secrete the beta HCG, and beta HCG is causing gynecomastia, enlargement of the breast. So that's why the answer is the large cell carcinoma. It otherwise, in the setting of examinations, if somebody mark me small cell carcinoma, some say squamous cell carcinoma, squamous cell carcinoma, and if I remember correctly, this question was asked in INI CET this year or last year examination for the January session. So this is very important. What mistake which commit in this question is smoking history is given, and so that's smoke too quick, and we all know that smoking causes squamous cell carcinoma. So majority of the answers we will find is squamous cell carcinoma. But if you read correctly or read minutely, then they are giving it enlargement of the breast. So that's why the answer is large cell carcinoma. Uh, then again, this is the question again is question number 16. Most of the student attempted wrong in this recently concluded postgraduate examination NEET PG, uh, because you have to, when you study this pneumothorax, then you study about the type of pneumothorax, age of pneumothorax, and then management according to the age and type. So in this case, patient is young and the and cause is spontaneous, and if you see the x-ray, so same x-ray was given in your examination. So in X-ray also showing less than 15 to 20% pneumothorax. So this much of pneumothorax is required only and only observation with the supplemental oxygen, because spontaneous pneumothorax may be, there are 3 4 different causes are there, and most important pathophysiological change is rupture of blebs in the lung, so that causes the spontaneous pneumothorax. And if it is not extensive, then the observation and supplemental oxygen is the choice of treatment in the young patient. Then we can treat the underlying cause, why it's happening again and again. Uh, so these all questions, you can go through it, and answers given, detailed answers given along with it. And when you will going through it, then you will know that every question have the potential. If you change the language by yourself, then the answer will change. And so what happens is, this is our general tendency. We studied the question, we read the question, and we go in the examination. If similar question appears, then we thought, okay, we did this one, and so answer is this. So it is very important that you read the question carefully and catch the keyword and accordingly answer. So in this case, keyword if changes, then definitely the answer also changes. So this is all about the respiration. And now by the this weekend, I'll post. I'm giving you the 7 days more time to go through the respiration presentation and study hard. So this is my suggestion, that whatever you are studying, you study in your pace, in your comfort zone. But remember, the paper will come in an integrated approach one. And why this integrated approach? This integrated approach is they are preparing for the next, to launch the next exam. Now comes to the some queries of the students, that next year what next? It's a NEET PG or next? So both. I'm telling you how. On 23rd of January 2023, you will have a NEET PG examination for the post-graduate entrance in government and private medical colleges, in the allotted seats, allotted in the different departments, clinical, paraclinical, and non-clinical. And then, because by the 23rd of January, the result will of 23rd January exam will come in 10 or 11 days time. The counseling will start, commence in the month of March last week or April first week, and it will be concluded in the April itself. So many students will miss the bus because their internship won't be completed by that time. But no need to dishearten for those students, because by the time your internship completes, the your next batch final MBBS examination also approaches. So what happens is, the final MBBS examination, which is as of currently now is taken by the different universities of the different states, will be taken by the National Board of Examination centrally on a similar pattern, integrated approach. They will all the questions will be the multiple choice questions, and the marks you score in that will be taken as your postgraduate entrance examination score also. And those who have completed the internship can go for the post graduation, but those who freshers who appears for the final MBBS examination in the next exam will have to complete their internship for 1 year, Then after completion of internship, there will be next phase 2, which will be conducted practical examination of the subjects of the final MBBS by the respective universities of the different state. So after clearing that exam, based on your next level 1 score, you will be able to participate in the counseling of the postgraduate admission. So first in January 2023, last time the NEET PG examination will be held, and by the mid or just immediate after within a 1 or 2 month of the mid year, next will sets in. The next examination will sets in. It will be conducted twice in a year. So because some students, universities are lagging behind, some are moving forward, or some are going with the pace, so there will be next examinations twice in a year. This next examination will be essential for all the students who are studying in India for the practicing. So what are the rules and regulations are there? So it will be notified, but as of now discussed is those students who scored more than 50 percentile or 50%, there is a dispute between percentile and percent. So 50%, more than 50% score, you can go for the practice. 40 to 50%, 6-month additional internship. Then if it is less than 40%, then you again sit for the next examination to improve your score in the second chance. So that's why the NEET next examination will be conducted twice in a year, but NEET examination, NEET postgraduate examination on 23rd January. And in this week, you will find the tentative dates on the NBE website. So this is about the confusion, and that's why in my heading I am giving you the uh, NEET PG 2023 guidance. I am not giving the uh, next 2023 guidance. This is the NEET PG 2023 guidance, and you will be lucky one or to give this examination, and you can say that we were the last one to give this NEET PG examination, which will be on 23rd of January 2023. And regarding other queries and other things, uh, please note that I have received the some information regarding the diplomat seats, diplomat national board seats. So I am doing my analysis. In day or two, I'll come live again, and I'll post the NEET PG 2022 counseling second video regarding DNB counseling expected cutoff, and based on the number of seat increased and based on the last year cutoff. There were some mistakes were identified by the users about my last video my last video. So I'll rectify those numbers, and I'll share that number slide again with you for the MDMS cutoff for the different categories. So this is all for you today, and I hope you all must have note down the answers, and a request to all of you who are preparing for the NEET PG 2023, keep on studying in your pace, in your comfort zone, but please go through these suggestive videos and suggestive questions with the answers, so that it will be easy for you to understand the subject, to understand the questions, and you may score with the flying colors in your examinations and can secure a good rank in your examination. Thank you very much. Have a nice day. Have a nice week ahead. Thank you very much. I'll post the GIT video